Well, thanks for being here today. You know, every morning, the safety director gives me a sheet that talks about all of the like Part 1 crimes. That might be the homicides, felonious assaults, robberies, rapes, those kind of things. And he includes in that all of the overdoses that occurred, all the ODs. And of that, he includes those that have overdosed and who have died. And then he includes in that how many were given Narcan. And as a result of Narcan, how many survived that overdose would have died but for the Narcan. And so I get that every morning. And I will tell you, out of all those other crimes, those Part 1 crimes that I listed, you add them all together, and you still may not have as many of those crimes that you will have of people who overdose. That is how many overdoses occur on a daily basis. And you know, and in 1985, EMS, our Emergency Medical Service, they began to use Narcan as a part of addressing opiate, but of course they were not using it at the level they use it now. And then in 2015, the fire division was trained and they began to use it. And now I think the latter part of this year and in the first part, the latter part of last year and the first part of this year, the police department now has the training that they need in order. And are you 100%? Not yet. But their goal is, I imagine, in your zone cars, pardon me? Frontline officers will be trained in the use of Narcan. And you know, this is a countywide epidemic, and it is the opiates mixed with heroin. And half of the deaths have been outside the city of Cleveland, and sometimes over that. But there's a new trend, and that trend is that there's mixing of the opiate, fentanyl, I think it is, fentanyl, with cocaine. And there's some talk about even mixing with other drugs of choice like marijuana or meth or those kind of things. Well, that's very important because what has happened since drug trade is a big business. It's a business of misery, but it is a business. And as a result of that, they have recognized, meaning those who traffic in drugs, recognize that there are some customers that they're missing and that there are some untapped markets. And so the mixing with opiate with cocaine is really allowing the entree into more of an inner city population that is primarily African American. And we're beginning to see that trend. We're beginning to see that trend. And if this continues, not only will there be a need for Narcan, there will also be a substantial increase in crime and other kind of things in areas where this will be introduced. So just as you communicate to people, I'd like for you not to just talk about the city has trained the police for Narcan. I'd like for you also to let them know that Narcan is a great tool, and under the Project Dawn, it allows for friends and family members to administer it to save people's lives, but it is not a solution. And that those who make money off this are ratcheting up their game, and they're changing the way in which they market their product. So I'd like for you to at least communicate that, okay? So I'll turn over to Mr. Dinahan. Mr. Dinahan.
Thank you, Mayor, and thank you for taking the leadership to bring this this deadly disease to everybody's awareness and consciousness. This is the biggest killer of our society right now. And one of the consequences of it is the lack of real capacity to do treatment. Had it not been for Narcan saving 225 lives last year, we would have had over 740 people die from the heroin fentanyl. That tells you how it has exploded from around 224, 228 2 years ago. What hasn't kept pace with it is the number of beds for treatment. And that's what we're talking about in terms of the city of Cleveland has given us $250,000 for us to put into the other monies that we have collected from the county, which is $250,000, and the $1 million we're put in to increase the number of beds by 113. Now, it's very important because what happens is somebody wants to go in for treatment. The first thing they need is detoxification. We can't give detoxification if we don't have a bed. And the worst thing that we have said to too many people is come back in 2 weeks or come back when we have beds. Our hope is that with this additional money, we will have beds enough to treat all the people that need treatment, and hope that if they come in contact with our first responders, that they have the opportunity to have the Narcan to be saved, and it does save lives. So it's a combination of things. It's the introduction of the Narcan to, I guess, the first responders, and the building the capacity of beds to bring the treatment more in line with the capacity that we have right now for this epidemic that we have going on. Thank you, Mayor, and thank you for Council President for bringing this to our attention, and thank you for the support. I'll get over here.
Hi, good afternoon, everyone. My name is Dr. Tom Gilson. I'm the medical examiner for the county, and I wanted to thank my partners in the city for inviting me here. I would like to echo what's already been said about the importance of the introduction of Naloxone, both the police department, fire department, and the city of Cleveland. As Commissioner Dennehan just mentioned, Naloxone saved hundreds of lives in 2016 last year through Project Dawn, which is deaths avoided with Naloxone. The crisis is still very serious and it has worsened, but it would be infinitely worse without this life-saving drug being available. We saw a near doubling of overdose deaths in 2016 and 2017. Unfortunately, doesn't look like it's headed in a different direction. It does affect all segments of our society, and this major player that was mentioned, fentanyl, has become such a serious problem in all segments of society. We see about half of the people who live in the city and half who live in the suburbs as victims of fatal overdose. While traditionally our overdose victims have been white and male, we've seen a doubling over the last 10 years of women. And this recent development with fentanyl entering into the cocaine market has also shown a dramatic rise in the number of people of African American race, rising from 25 to 55 from 2015 to 2016, and more discouraging, rising already to 25 through February of this year, with a projection out to about 130 deaths. I've been asked at times, is this an epidemic? An epidemic is any disease that's present at a higher level than it normally is as a baseline in the population, and by any definition, what we're looking at is an epidemic. I'm grateful to be here with the other public servants to start to address and continue to address. I don't want to say start. A lot of people in this room have rolled up their sleeves for a long time to continue to address what I see as the most serious public health problem, probably for the rest of my own career. Drug overdose deaths account for more mortality as an accidental death than motor vehicle crashes. I write intoxication as an overdose death on more death certificates than I write homicide, and then I write suicide. And I would certainly hope that with these efforts we can start to turn that trend back. Thanks very much. I'll introduce Nicole Carlton, the Director of EMS.
Good afternoon. I'm Nicole Carlton, Commissioner for the Division of EMS. And as has been stated, we're looking at the use of Narcan, which is also that's the name brand for the drug Naloxone, so you may hear those used interchangeably. The role of EMS, we're reactionary to somebody who has already overdosed. So at that point, we're getting them, they may be unresponsive, and they may actually have stopped breathing at that point. What we do with the Narcan is to reverse the effects of the opioids, and we are actually bringing back their respiration so they can start breathing on their own. That is the importance of the drug and how important it is for us to have it and for all the first responders to have it. We noticed, as far as on the EMS side, an increase in 2015, a slight increase of overdose and overdose deaths. In 2016, that number actually tripled for us as far as the number of patients that we saw that were overdosing. In 2015, the Division of EMS worked with the Division of Fire to actually put Naloxone, the Narcan, on all of the first responder vehicles, so they were trained. That increased the number of first responders to 53 apparatus that can actually provide that life-saving intervention. In August of 2016, as we saw that this was becoming increasingly more common in the city, we partnered with Project Dawn to actually provide the kits, the Project Dawn kits, to the community. The Project Dawn kits have Narcan in them. They have little face shields for somebody to breathe, and they actually have an instruction booklet. We provide those on all of the ambulances, and we have since August of 2016, as well as we distribute those and dispense them from EMS headquarters, which most of you will be coming to watch the police training at 1701 Lakeside. We dispense those from Monday through Friday from 9 to 4, and we invite the community to come and receive those. We have dispensed over 200 kits to the community from EMS headquarters as well as the ambulances, and we have over 30 documented saves. That means somebody has come back to replace their kit after they have used it. So we are making an impact in the community, and we will continue to do so. In 2017, we started to train the Division of Police on how to identify overdose and to use Narcan. We will be training them for the next several weeks, up to 4 weeks will be done, and then we will provide the kits to all the frontline zone cars. And I believe you're coming afterwards, I think it was in the press release, to come down to EMS headquarters to watch the training. I'm turning it over to Director Gordon from the Health Department. Thank you.
Good afternoon. My name is Meryl Gordon. I'm the Director of the Cleveland Department of Public Health. I want to say that all of our efforts are done in partnership. We're doing partnerships with community organizations and with all levels of government, from federal, state, county, and also within the city of Cleveland. We can't do this alone, and there's no way that we can address this alone. Today's non-fatals due to Narcan might be tomorrow's fatals. So in order for us to really make a dent in this, we really need to focus on the prevention message, education, and treatment in this incredible epidemic. Immediate detox is really critical as well to breaking the addiction cycle. So we are thrilled to be able to partner with the Adams Board and with the county towards $1.5 million in additional beds, recovery, treatment, and residential and sober beds here in this community. After Narcan is administered and the individual comes out of that high, we know that there is an immediate need at that point to get them the help if they so choose it. And so that immediate pathway to treatment is really critical and why we are investing in this effort to expand beds. I also want to underscore what the mayor indicated at the beginning, is that fentanyl is making its way into perhaps unlikely substances. And so if somebody is choosing to use a substance, they need to be aware that this might be laced with this toxic substance of fentanyl and also carfentanil and could be lethal. So we want to make sure that this message is getting across as widely as possible so that individuals really are aware of what might be out there. Thank you very much. Turning it over to Chief Williams.
Thank you, Director. Good afternoon. Again, the Division of Police has started training with EMS of all our frontline officers and the administration of our Narcan, or Naloxone. The Division of Police has been at the forefront of this battle with overdoses for the last 4 or 5 years. And recently, as everybody has stated prior to me, the numbers have gone up to levels that we haven't seen before. In 2015, the division responded to a little less than 900 overdose cases. Of those 900, approximately 200 of those were fatals. So far this year, we've responded to a little less than 260, with about 57 fatalities. 33 of those fatalities were just in the month of February. So you can see the level of concern that we have, and you can see the level of the problem that we're facing. The division staffs a squad specially designed and trained to investigate and respond to overdoses, to try to track, be it by witness statements or the evidence collected at the scene, back to the source so that we can stop this tide with synthetic drugs and heroin. And we're to the point now where, like Director Gordon says, you know, we're bringing everybody in on this. This is definitely a collaborative effort, and we want to make sure that, first of all, people are aware of the problem, and second of all, that people know that there's help out there. The Project Dawn kits are a great advantage, and what the Division of Police is going to be utilizing here in the next month or so is going to be right in line with what's happening around the country. So I want people to know that we're out there. Our officers will now be able to save lives, just like our counterparts with fire and EMS, and people need to ask for help if they need them. We've always advocated for more bed space for treatment of this issue. It's an issue that, unlike other addictions, it's hard to kick. I mean, people that see their friends, their relatives die, and then still continue to use this drug and overdose on it, it's got to be, you know, something that is heartbreaking to families to see that happen. So we want to make sure people understand that there's help out there. We as a city here and a county are trying to make sure that we put everything out there possible to save lives and also educate people on this issue. I'm going to bring up my boss, the Director of Public Safety, for a few words. Director McGrath.
Thanks, Chief. Good afternoon, everyone. Mike McGrath, Director of Public Safety. I've been asked to sum up in a very general sense the presentations that took place before me. So I'll try to give you an overview at 10,000 feet of what we've been dealing with over the last 6, 7, 8 years. But for many years, cocaine was the drug of choice. Cocaine was up here and heroin was down here. And cocaine was introduced to the inner cities back in the late 80s, early 90s from the West Coast. The cocaine use over that timeline, far better than any other drug, sustained. It sustained its use up until the last few years, going back 5 or 6 years ago. And that's when heroin started to make a comeback, specifically in the suburban communities. But now, with the addition of fentanyl and the marketing of same, meaning the heroin and the fentanyl, heroin has risen in popularity, expanded in the drug market, so much so it has equaled or surpassed cocaine usage, especially in reported fatal overdoses. And some of those statistics were provided by previous presenters here. To address these issues, meaning the introduction of fentanyl with heroin, the city is taking a holistic approach, which means that this includes the Department of Public Health, Community Relations, Department of Public Safety, all 3 divisions, partnering with our federal, state, and local agencies. But as a community, we have to do more. We really have to do more, folks. The community as a whole has to engage in these issues. And the 2 key words are education and awareness. And that's where you, the media, can play a role. We need, at every opportunity, to communicate and relate these new dangers that evolve around this new drug usage. When you make an illegal drug purchase, there's no prescription bottle that lists a percentage of heroin, cocaine, and fentanyl. neither does it list what's actually in that purchase or what combination is in that purchase. Also, when you're purchasing these doses, it doesn't account for the size of the individual, the mental or physical capacities of those individuals. We have to remember that the people that put these doses together aren't licensed pharmacists. The illegal drug trafficking organizations only have two goals, and two goals only, and that's to put gold in their pockets and don't get caught. They don't consider the pain, the suffering that are inflicting on the victims, their families, and the core of our communities. And I've said this before when I was a chief. I'd say crime is a symptom of the social ill. Well, drug usage, like crime, is a symptom of some other issue that's happening in a person's life. And to provide relief as a community, we have to identify those issues and provide treatment options. Now, a lot of the information that's being provided may appear to be repetitious, but if that's what it takes to save a life, then so be it. We need to be transparent, and the community needs this information. Thank you.
Hi, my name is Kevin Kelly. I'm the president of Cleveland City Council, and much of what needs to be said has been said, but let me just reiterate, because we can't say it too much. We can't stress the urgency too much. In 2014, the mayor and Mr. Denahan, we did a public service announcement about the dangers of prescription drugs. Perhaps you remember that. And at the time, it was approaching 200. And I was sure that that had to be the top. I was sure it could not get much worse in 2014. Well, sure enough, it's doubled, it's tripled. And this has to be seen as the #1 community health crisis that we all have to deal with. And as we are here today, we're here to talk about the community coming together to deal with this terrible disease on a number of facets. First, the Project Dawn is tremendous. All the work that our first responders are going to do is going to go a long way towards saving lives. We're involved in a cooperative agreement with the county, with the Addis Board and the county to provide residential treatment beds. But I just want to caution you that this is far from the end, and Mr. Denahan, if you would just correct me if I'm wrong, but once in treatment, that is not a cure. Many people that enter treatment will fail, and it's something that we're going to have to keep at again and again. This problem is not going to resolve this year. This problem is not going to resolve when we add these new beds and we get people into beds. We have to expect relapse. We have to expect the community to dig in this problem and not let go until it is solved. And it's not going to be quick, and it's not going to be easy, and it can only be done if all of us recognize the urgency, recognize how complicated a problem it is, and devote the time, resource, and attention that it needs. So, thank you.
Questions?
A quick question. As far as beds, how many beds are available now, and how many will be as this funding is put to use?
We have funding for 147 beds. They're broken into residential beds, broken into medically assisted treatment beds, and broken into sober beds, which are more for long-term stays. The additional number of beds will be 113, which will bring us to 260 beds. It is still not enough. 2 years ago, we had 224 deaths. I want to remind everybody, Ohio led the nation in the number of fatalities, exceeding that of California and New York. Last year, we had 517 deaths. Would have had over 700 had it not been for the Narcan program. So the number of beds are extremely important. The chief reported over 900 overdoses. Each one of those overdoses that are not dead require treatment. And there are others that don't overdose that require treatment. Those treatment require beds. So it is a beginning. It's not the end. We still have much more to do.
Mr. Dennett, could you explain to them the reimbursement and how that doesn't fully compensate or sometimes gets in the way?
The mayor is referring to is part of the Affordable Care Act and reimbursement through Medicaid does not pay for beds. We have to pay for that locally, and it's a huge expense. Medical assisted treatment beds have medical assistance 24/7. Those beds that are after detox require treatment at least for 24 hours and sometimes for 4 days and 5 days. That is a huge expense. So many of those expenses that we're talking about are not covered by Medicaid, which is a local challenge that continues to deal with this. The issue of day treatment does not work in this episode. We're finding that we have to put them in a long-term bed so that they understand sobriety is a way of life. And we found that when we put them in the residential beds and then sent them home, we cycle back because they went back to where they became addicted. So we're finding in this, what I call tsunami, is that we need the long-term beds. And this is a beginning, Mayor and Council President. We appreciate your support on that, but it's a beginning.
Question, sir. Do you have a percentage of the one who went through the treatment did not go back to use it again?
No, I do not have one right now because it depends as to how long they're in treatment and what their addiction is and their age and a whole number of other things. But we do know one thing. The longer they're in treatment, the better the recidivism rate. When we have folks where we just put them in a detox and have them 5 days for treatment or maybe 30 days, and they go out, they come back again. And as Council President Kelly just said, it is part of the process that recidivism is not where we want to be, and it is part of the program that we provide the opportunity to have beds so when they do relapse, that they have the ability to come back.
Anybody else?
The money for the additional beds, the 1.5 million, does that fund them just this year, indefinitely? Is there like a certain amount of time that money is used for?
That money is just for this 1 year. And my hope is that there will be the ability to show the value and worthiness after the year so that we could get continued funding for it, but it just is for 1 year.
I just have one last thing to add. In the Adams Board is part of the Project Dawn program. The Division of EMS is the only pre-hospital care provider, first responders, that actually dispense the Project Dawn kits when we are on calls for overdoses, as well as out of our EMS headquarters. So, working in collaboration with the Project Dawn group, it actually is one of the first in the country that is providing this to our citizens. Yes.
Will there be any efforts to teach students or faculty at schools on how to use Narcan kits? Or where to get
With the
them?
schools, the health department? Want me to answer that? People can actually come to my headquarters and get it. It's not necessarily students. It's anybody who has a family member, friend, anybody at risk, and we actually dispense it to them. They have to be over the age of 18. They can come to us. As far as in the school system, I'll either defer to health or to the Adams Board.
I cannot speak for the schools per se, but we also have these Project Dawn kits available at the health clinics, at the City of Cleveland health clinics at McCafferty and at Jay Glenn. So these are available. These are also available prescription-wise and over-the-counter in some pharmacies.
I could add something to that in terms of who our victims are. For the heroin deaths, it's actually people ages 45 to 60. And for fentanyl, it actually goes down about to 35 to 40 age group. I think in the schools, our bigger thrust should be actually towards education and prevention in those efforts. I think, like a lot of people have said here, if we don't turn off the spigot of demand, I think the supply will always show up. But I think in terms of where Narcan would be most effective, it's probably not necessarily at the school level, at that level. I think education's far more effective there.